Hi, good evening, everyone, and thank you for joining us at this virtual town hall. My name is Colleen Coleman, and I am a social studies teacher at Burnsville High School. Just like all of you, my students are learning to navigate life through this pandemic. Some of them are taking classes in a hybrid, some of them are taking classes only virtually, and some of them are with us tonight. So again, welcome to everybody. We are very excited for tonight's event. Before I hand it over to Representative Craig, I would just like to go through the agenda of how this evening is going to work. Shortly, Congresswoman Craig will provide an update on her work in Congress. Then Dr. Carrie Hinning Smith, Associate Professor and Deputy Director at the University of Minnesota School of Public Health, will give an update on the coronavirus pandemic. Following her remarks, we'll be taking questions from all of you that you can add in the comments below. Just like we established rules and norms in our classroom, we have certain Minnesota Nice rules for this town hall. So tough questions are welcome and encouraged, but obscenity is not allowed and those questions will not be asked. With that, I'm going to hand it over to Angie to lead us in the Pledge of Allegiance and to give her opening remarks.
Thank you so much, Colleen. It is really an honor to have you here as well, and I'll say just a little bit more about you in just a moment. I come from a military family. Two of my uncles served in Vietnam, and my grandfather served in the Navy. So I always start out every single town hall recognizing this nation's veterans. Thank you for your service and for your sacrifice. Now, I'd like to lead us all in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Awesome. Thank you so much to everyone for being back with me this evening. This is my 22nd town hall since I was sworn into the U.S. Congress in January of 2019. I also want to welcome back Colleen. Colleen was my very first moderator, so it's so exciting to have you back with us this evening, even though we are in a little bit different setting. I remember, I think we had the cast of your school performing Hamilton together the last time we were together. You know, I'm holding these town halls every month to give folks an opportunity to come and ask me any question that you would like during, of course, normal times. We have them in person throughout each county inside the 2nd Congressional District. Today, though, I am incredibly excited about the opportunity to meet with you, but also just looking at some of the COVID numbers from today, I'm so glad we have back a public health expert from the University of Minnesota. You know, I take every single one of the more than 2,300 tragic deaths of Minnesotans seriously from COVID-19, and our hearts and our thoughts are with all of the families who've lost a loved one during these very difficult 8 months, or those of you who may be fighting the virus here today. I want to continue to urge everyone to wear a mask, to physical distance, to make sure you wash your hands, and I'm sure our public health expert will say a lot more about this over the next little bit. Like many of you, I have a son who is still in high school. He's 17 and he's a senior at Rosemount High School, and school has changed a lot. He's doing a hybrid approach to learning here in his senior year, and I just want to do a quick shout out to all the parents and the teachers who I know are working as vigorously as possible to make sure that our students get the best education that they possibly can under incredibly difficult circumstances. So I just want you to know that we know how much sacrifice you've made. I also want to just make sure we recognize the businesses that are struggling through this pandemic. You know, the restaurants in our communities like Wildcats here in Eagan, or Spiral in Hastings, or Plate in Prior Lake. All of those wonderful Main Street businesses continue to order takeout, continue to give our local craft breweries, continue to give those local businesses your support if you can. I'm going to first maybe just do a little bit of a summary of the course of work that I've done in Congress, and then I want to come back around to the public health issues that are so important right now. So since joining Congress, not only have I had a town hall every single month to answer your questions and listen to your concerns, but we also get an extraordinary amount of correspondence to our district office here in Burnsville, as well as to our Washington, D.C. office. In fact, since January of 2019, we've received and responded to more than 73,400 calls, emails, and letters. And if we're not able to get to your question tonight, you always have the option of emailing or calling our office. But if you go to craig.house.gov, that will allow you to put a message directly to my office, and we will respond to you. I've also worked on meaningful legislation to help folks in our community. Since joining Congress, I've introduced 31 bills and amendments and co-sponsored over 530 additional bills. 80% of those bills that I've co-sponsored or that I've written have had both Republicans and Democrats on them. 2 of the bills that I wrote have been signed into law by President Trump. That's as many as any other member of the Minnesota delegation, Republican or Democrat, and the most among the Minnesota freshman class. You know, I want to give my staff the biggest shout out there because I have such an extraordinary team. And as many of you know, part of that extraordinary team is my casework team. In fact, we have resolved 1,146 cases and helped recover more than $675,000 for constituents in the 2nd District here over the course of the last 2 years. So if you have an issue with the federal government, whether it's a Social Security issue or a veterans benefit issue, please call my district office. And if our casework team can help you, we certainly will work to do that. As always, please reach out to the team again, one more time, at craig.house.gov. So lastly, I just want to end before we talk a little bit more about COVID with I really appreciate the folks who come to my town halls in person or as we do them virtually during the course of the COVID-19 pandemic. And what I'm most proud of is even though we may not agree on every single issue, our forums have been incredibly civil, and I just appreciate all of you coming and sharing your viewpoints with me. So with that, I really want to turn to a little bit of an introduction, and I'm going to turn it over to our health expert, Carrie Hinning Smith, in just a moment. But I know she's going to be here mostly to answer your questions about the COVID-19 pandemic. But before I do that, I just want to acknowledge that we are seeing a huge spike in cases around this country. We're seeing a huge spike in the average number of cases in Minnesota, and we're seeing infections rise in 42 states. So with us this evening, we have Dr. Carrie Hinning Smith. She is an associate professor of the Division of Health Policy and Management and deputy director of the Rural Health Research Center. And in particular, Dr. Hinning Smith has a specialty in looking at health with a particular focus on those historically marginalized populations, and also some really interesting research on isolation in rural areas. So Dr. Hinning Smith, it's an honor to have you with us this evening, and we'd like to start out with a few remarks from you.
Thank you so much, Representative Craig. It's an honor to be here. Thank you for having me. As Representative Craig said, I'm a public health researcher. I focus on health equity, social determinants of health, and rural health primarily. And as your representative from the public health community, I wish that I had better news to report tonight than I do. We are entering the 10th month of the COVID-19 pandemic here in the United States, nearly 10 months since we've had our first case in the country. And we're marking more than 7 months since we've taken serious measures to socially distance and restrict the virus's spread. Since the pandemic started in the United States, we've seen nearly 9 million cases and nearly 230,000 deaths across the country. It has been a long several months. And yet, this pandemic is far from over. In fact, we're seeing the largest spread since it started, with a record-breaking average daily new case count of more than 75,000 cases a day over the last week in the United States. That amounts to more than 500,000 cases a week. Yesterday alone, we saw more than 81,000 new cases in the United States and more than 1,000 deaths from COVID-19. All of Minnesota's neighboring states, Wisconsin, Iowa, North and South Dakota, have among the highest per capita rates in the country. Here in Minnesota, we have had more than 142,000 cases over the course of the pandemic so far, and more than 2,300 deaths, as Angie referred to, since the pandemic began. We are also seeing increased case numbers here in Minnesota as we're seeing spikes across the country. Today, we had 2,849 confirmed new cases, and that brings us to more than 15,000 known active cases across the state of Minnesota. This is the highest case count we've had since the pandemic began. 32 new deaths from COVID were reported in Minnesota today alone. It's also really important to acknowledge that COVID-19 has made existing health equity issues worse. Health equity is really where I focus the bulk of my work to understand who's not getting a fair shot, how our opportunity is not being distributed equally for good health and good quality of life. COVID-19 hasn't caused these issues, but it's revealing issues that we already knew existed, and it's making them worse. For example, here in Minnesota, Black residents make up 7% of the state population, but 16% of its total COVID-19 cases. Similarly, Latino or Hispanic residents make up 6% of Minnesota's total population and 15% of its COVID cases. Indigenous Minnesotans, our Native brothers and sisters, have a case fatality rate from COVID. That is the percent of people with positive COVID tests who die from COVID, twice that of any other group. They have a case fatality rate of 4% compared with 2% among white Minnesotans. We're also seeing disparities by geography. For the past several weeks, rural counties across the country and specifically here in Minnesota have shown higher growth in cases than urban counties. As Angie said, pandemic fatigue is real as the months wear on and we look ahead to colder weather, or maybe back to colder weather. We had snow here last week, but as we think about colder weather, needing to be inside, it gets harder to be outside. I know that this pandemic fatigue is real. People want to go back to life as usual. I want to go back to life as usual. I want to be with my family on Thanksgiving. I want my kids to hug their grandparents without worrying about risks. But it's really important to emphasize that we are not out of the woods yet, far from it. And as difficult as it is, we need to continue to be patient and take safety precautions and follow the guidance of public health professionals and scientists and experts on the front lines of this pandemic. This includes limiting social gatherings, wearing face masks, and of course, hand washing, as Angie mentioned. We are all in this together. That's the thing about a virus. It's not one person's issue. It's all of our issue. We share this issue, and we have a responsibility to keep one another safe. Thank you again for having me tonight. Thank you to Representative Craig for the opportunity, and I'm really looking forward to the discussion that we'll have.
Carrie, thanks so much for your remarks, and Angie for getting us started. We're going to start now with questions that people have posted in the comments. So again, feel free to participate, add your questions, and we'll be directing questions to both Angie and Carrie. Okay, this first question is for Angie. Danielle asked, what's your stance on homeschooling, and how do you view educational choice? Would you stand up against a movement to nationally outlaw homeschooling?
Well, Danielle, thank you so much for this question. Obviously, for every single parent out there, caregiver, our child's education is always a number one priority and concern. And, you know, I really think that it's up to the states to determine what are the rules and regulations around homeschooling across our country. You know, as if you know me, you know that I'm a strong supporter of our public schools, and especially as it comes to Title I and funding for special education. But I really do think it's up to each of the states to determine what are the rules around homeschooling. But thank you again and for being here, and thank you for your commitment to education in this country.
Thank you. Okay, this next question is for Carrie. Karen asks, with COVID numbers spiking in Minnesota, what does science say our next step should be? And how do we go about communicating this so everyone believes and acts accordingly?
Thank you, Karen, for the question. It's a really important one, and I wish that I had the perfect answer. I wish that I could figure out how to get everyone on board. In terms of our next best steps, it's really nothing different than what we have been doing, following the guidance of our public health leaders, of Commissioner Malcolm at the state level, Dr. Anthony Fauci at the federal level, wearing a mask, washing your hands, limiting your interactions with other people in person, and especially, as I said, as we're headed into colder weather, being really careful about being indoors with other people. We know that the transmission rates indoors are higher simply because the air sticks around a little bit longer. It's easier to transmit it. So being really cautious, really careful in the same way that many of us have been the entire time. The second part of your question, in terms of communicating this to make sure that everyone gets on board, I think it's a matter of getting the message out as often as possible. As I said, I think pandemic fatigue is real. I think people are sick of this. I get that. I'm sick of this. I'm sick of talking about it. But it's not going away. It's getting worse. And so we need to continue to talk about it. We need to continue to have events where virtual events, not in-person events, but events like this where we spread the news. It needs to be in the media. And all of those need to follow good science and good evidence. Unfortunately, there are parts of this pandemic that have become partisan in some places. With some perspectives, wearing a mask has become a partisan issue, and we need to move away from that. We need to see this as bipartisan, as all of us together and everyone following the science to keep everyone else safe.
Thanks so much, Carrie. Okay, we have another COVID question, and this one is for both Angie and Carrie. Angie, we'll start with you. Abad asks, as COVID numbers rise across the Midwest, how is your work on this issue evolving? And how do you see the pandemic situation evolving? Based on what you've heard, how long will we have to stick with social distancing and masking?
Well, thank you for the question, Abad. I wish we all knew the timeline, but sadly, the virus will determine just how long. One, we need to make sure we wear masks and socially distance. But I think as public policymakers, let me take a little bit of a swing at this. One of the podcasts I do try to get to every single week is Dr. Michael Osterholm, who I've had the honor to have on my town hall a couple of times now, and I actually just caught up on his latest one from this afternoon. And what he was indicating, and I'm thinking about this obviously from a public policy perspective, but also from a public health perspective, but also what Congress needs to do to respond. And so as he talked about, as we look at these rising numbers and we see that maybe shortage of staff in ICUs are going to be one of the biggest issues moving forward, instead of a shortage of beds, it's actually going to be, are we going to have enough nurses and doctors and folks on the front line of healthcare? He talked a little bit about we really haven't done what we need to do to have an adequate supply of personal protective equipment for our healthcare workers and for our long-term care centers. So we need to make sure that we're effectively utilizing the Defense Production Act. We're doing everything in our possibility to make sure that we've got that PPP available. And then, one of the things I've mentioned before is I helped co-found the Supply Chain Caucus, bipartisan Supply Chain Caucus of the U.S. Congress. And one of the major factors he believes are going to be at play is a shortage of drugs needed to treat these patients. Not necessarily the drugs to treat COVID, but intubation-related drugs, things like that. And so when you think about those rising cases, we need a next round of the Paycheck Protection Program yesterday. We need the Restaurant Act to be passed, $120 billion in grant money for our Main Street businesses, our local restaurants. We need economic stimulus checks to Americans again. So, it is going to be, I think, a challenging 6 to 8 months, and a set of really difficult choices, frankly, for public policymakers. And I think, we've all got to be willing to step up to the moment. We are gonna get through this because we are going to get to a vaccine. But in the interim, all of these things are things that are on my mind, and I know we can do this if we do it together.
Thank you. Carrie, do you want to answer?
Sure. I completely agree with Angie on all of those points, and I'll just emphasize that the virus really is in charge here. We need to do everything we can to stop it, to slow it down. That means all of the precautions that I mentioned already, and it also means working on a vaccine, and there's really good work going on, but there is a certain process to that can't be rushed through. We need to ensure that the vaccine is both safe and effective. It's still an open question when that vaccine is going to come around. I'm hoping that we see it in the early part of next year. It's possible that it will take longer. There have been some hiccups along the way for some of the companies working on developing the vaccines. But that has a lot to do with how long this is going to take. Once there is a vaccine, though, we have a whole other set of issues that we need to work through. We need to make sure that people get the vaccine, that people are willing to accept the vaccine, and that we can move on to that herd immunity point. And all of that will take some time. And so this is just going to require a really frustrating level of patience for all of us. I suspect that things like wearing masks and socially distancing will be some of the last things to go from this, and that they'll be sticking around for a little while.
Thanks so much, Carrie. Okay, back to you, Angie. Chuck asks, if the Affordable Care Act is struck down by the Supreme Court in the week following the election, how soon would it take effect? Would policies purchased before the decision still be honored for 2021? And will there be time for Congress to address this before people lose their healthcare coverage?
Chuck, these are great questions, and I wish any of us had the answers to this. As you most likely know, on November 10th, the administration and others will be before the Supreme Court arguing that the Affordable Care Act should be tossed out in its entirety. It depends on if the Supreme Court finds the entirety of the Affordable Care Act unconstitutional or only parts of it. But regardless of that, I think the next Congress is going to be tasked very quickly with making healthcare complete, making sure that pre-existing conditions continue to be covered, making sure that we don't go back to a time when you could simply deny someone based on a pre-existing condition, or you had folks who would reach lifetime limits. I keep thinking about my good friend Kim, who lives in this congressional district, who I had the honor of bringing to the State of the Union in my second year here, who has metastatic breast cancer, and just, how many times she would have reached that lifetime limit if the Affordable Care Act were not the law of the land. I think about, the college students at Carleton that I talked to last night, who, about getting out and voting no matter who they voted for. And the fact that so many children now can stay on their parents' plan until age 26. So the next Congress, needs to be ready to put a new healthcare law into place in the next Congress. And so these are really, really critical questions. And I know the 51% of non-elderly in our district has a pre-existing condition. So these are really personal questions for them as well.
Thank you so much. Okay, we're going to go back to a question for Carrie. John wants to know, how do we address the apparent lack of concern with COVID guidelines in rural areas?
Thanks, John, for that question. This is near and dear to my heart. It's something that I think a lot about, and I'm going to give a few different angles to this. First, I want to say I think it's one of the biggest tragedies of this pandemic that there are pieces of it that have become partisan or politically charged. And certainly not all rural areas vote in the same way, but they lean in one direction more than the other. And we've seen some of this turn into political fodder. So I think we need to get away from that. We need to get all politicians across the aisle on board with all of the safety measures that we need to take. But I don't think that's enough to solve this issue. I think that people are more likely to want to listen to their family, their friends, their loved ones than they are to to whoever might be talking to them through Facebook or through the TV screen. So I think if you know people, if you have people in your lives who you love, who you're concerned about, and who are not taking this seriously, it's worth mentioning that we're at the worst place we've ever been in this pandemic. This pandemic is serious. It's real. It's considerably more lethal than the flu. So if you hear people talking about that, this is something that we need to take seriously. But I think it's also worth considering who lives in rural areas and why this matters so much. Rural areas, and some of you listening may live in rural areas, the 2nd District includes some. Rural areas have older ages on average, and folks living in rural areas tend to have more underlying health conditions. Health statuses of rural residents are worse on average than urban residents. Rural residents are also less likely to have health insurance and more likely to have lower incomes. All of this complicates the picture. It means that once COVID gets into a rural county, and at this point, we can pretty much say that COVID is in virtually every county in the country, urban and rural alike. But once it gets into a rural county, it's more likely to be lethal. It's more likely to do significant damage because of those issues, because people with some of the biggest risk factors live in greater concentrations in rural areas. I think that point hasn't been communicated clearly enough. And I think if we make sure that people know that even if they don't feel concerned for their own personal risk, their neighbors, their loved ones, their friends and family might face a serious risk, I think that would help. And then I also think that we need to acknowledge the need for economic support. It's hard for some people to sit it out from work or to stay at home, to socially distance. So if we have more economic stimulus, the sorts of packages that Angie mentioned already, I think that would help give people the opportunity to make a choice to stay home. And coupled on top of that, rural areas across the country, and this is true in many parts of Minnesota too, are less likely to have broadband internet. They're less likely to have reliable cellular connectivity. For all of those reasons, it's harder for some rural residents to choose to socially distance. And so any policy measures that we can put in place to help to bridge that digital divide and help to give people the choice to stay home if that's what they want to do and if that's what they're going to do to keep their friends and neighbors safe, those are really important measures that we need to take.
Carrie, thanks so much for sharing your expertise on rural communities. We're going to go back to Angie. Angie, Chuck wants to know, will renewing the vote for H.R. 1 be the first order of business in the new Congress?
Well, thank you so much, Chuck. It's a great question. For those of you who may not know the order of our bills in the 116th Congress, what Chuck is asking is whether campaign finance reform is going to be a high priority in the next Congress. And it's an absolutely high priority. In fact, Democratic leadership, I believe today, said it would be one of the first priorities in the 117th Congress. And the reason that is so important, as you recall, the Supreme Court in the Citizens United ruling ruled that corporations are people and that they have a right to essentially unlimited funding, the dark money. In other words, we don't know where that money is coming from in super PAC funding. So you have seen since the Citizens United ruling really an explosion in outside dark money into congressional races around the country. And so, that's H.R. 1 would provide transparency to that. In other words, if a corporation is considered a person and wants to contribute to a super PAC, so be it. But we would make sure that folks know who is funding those outside ads that about this time of year, I'm sure you're all sick and tired of. So absolutely, it'll be a priority. A priority for me in H.R. 1 too would be getting my amendment, making sure my amendment from the 116th Congress is included that would prevent members of Congress from serving on corporate boards. Mm-hmm. Many of you know I spent a couple of decades working in business, and there's no way as a member of Congress I would belong in a boardroom opining about the policies that I therefore would need to vote on. And so, and I'm going to try my best to get as much of the Humble Act in the next Congress too. And as you may recall, the Humble Act banned members of Congress from serving as lobbyists after their service to their constituents, in addition to banning members of Congress from owning individual stocks, which we all know has been problematic, particularly in the Senate in the 116th Congress. So a lot of reform needs to happen, Chuck, and you better bet I'm going to be right in the middle of making sure that happens in the next Congress as well.
Thank you so much. Okay, this next question is for both Carrie and Angie, and this time we're going to start with Carrie. Linda wants to know, how do we continue vanquishing the virus while reviving our economy? What additional legislation would you like to pass? Would you like to see passed in addition to the HEROES Act?
Thanks for that question. I'm going to leave the legislation issues to Angie. But I will say for the question on vanquishing the virus and reviving the economy, I think it's a really, really good question. And the important point to make here is that these are not two parallel lanes. They operate in concert, and we cannot have a healthy, thriving, functioning economy while we have a pandemic ravaging the population. And I think that what we really need to do is get the virus numbers under control for anyone who's able to work from home, to socially distance, to do what they can to stay out of contact with other people. Please do so. Please wear your face mask, wash your hands, distance as much as possible, as hard and as painful as that is. That is really the best way that we can revive our economy, by getting these case counts down so that it's safe once again to reopen, to start to go back to life as normal. But we cannot do that. We can't have a functioning economy with the virus moving through the population the way that it is now.
Thank you.
Let me just add to that, because I appreciate your comments, Carrie. And keeping the economy running while we get to the vaccine is a critically important role. And I know the Federal Reserve has been incredibly active in it's monetary policy to try to keep as many businesses functioning as possible. And I'll talk about a few of the policy things here in a second, but it's just stunning to me, the study, and I know it was in the Star Tribune this morning, it's in a number of publications today, that 95% face mask use could save 129,000 American lives through February, just published today. And we'll try to get you a link to that study here while we're on the town hall today. But if you think about, what's happening with these rising case numbers, what I've said from the start is that we need a federal strategy around rapid testing. It's really hard when you see this much community spread. I think the positivity rate right now in Minnesota is above 7%. Jan Malcolm, the governor, they talked about wanting to keep that near to 5%. But when community spread gets up this high, it's really, really difficult for our health departments to contact trace. The way that we suppress this virus is through wearing masks, physically distancing, but it's also rapid testing and contact tracing. And once you get to these numbers, you make that incredibly difficult for our public health officials to pull off. And then after contact tracing, you isolate so that community spread starts to slow down. And the truth is, if we want to keep our economy open and running, at least to the extent that it is, we really need to be more compliant on the front end of these things: the masks, the social distancing, the hand washing. So, those are my comments there. But all of that leads to this. We know that with COVID so rampant, people are going to be very, very reluctant to go sit inside your local restaurants. That's why we need the Restaurant Act to be part of the next COVID relief bill. We know even with the GDP numbers out today that there are 11 million fewer Americans working today versus a year ago today. And so we really need the plus up of unemployment insurance. We need a second round of paycheck protection forgivable loans for these businesses to be able to stay operating as we get to the vaccine. I think Dr. Osterholm said today, there's light at the end of the tunnel. It's a vaccine. Obviously, it needs to be robust. The phase 3 clinical trial follow-up period needs to be robust to make sure that people have confidence to get to the vaccine. But in the meantime, we're going to have to help support those who've been furloughed, the unemployed, those small businesses, if we want to keep them running. Again, I keep coming back to restaurants, and the hospitality industry has just been decimated by this pandemic. State and local government assistance needs to be there. We saw today that everything is on the table here in Minnesota to balance the budget. The state of Minnesota has to balance the budget. Right now is the time for policymakers to step up and be bold and get this done. I supported the HEROES Act. I supported HEROES 2.0. And I've said to my constituents, I would support the bipartisan Problem Solvers Caucus proposal as well. So, there's a lot of different ways to get at this, but we need to make sure that, we continue to respond to the needs that are out there in our communities, keep the engine of the economy running so that once we get to the vaccine, we can stand this back up and get this country running full speed again.
Thank you so much, Angie. Okay, this next question is for Carrie. Carrie, to follow up on your earlier comments about the impact on rural areas, your research has found that older adults are particularly vulnerable, especially their emotional and social well-being. Could you talk a little bit more about that?
Yeah, thanks for the question. I love this topic. And I think that there's a lot that we can do to improve quality of life for older adults in rural areas and anywhere they live. So in my research, I have found that older adults in rural areas have bigger social networks. They have not only bigger families, but also more friends than older adults in urban areas. This is a good news story. In doing rural health research, I often find deficits, and I love to find the good news stories because I know they're out there. But I've also found that those same older adults in rural areas are more likely to say that they sometimes feel lonely compared with older adults in urban areas. What this tells me is that it's not a lack of people necessarily, but there are barriers to connecting with other people. These barriers have become even more pronounced during COVID. I think there are very few of us who haven't felt isolated at some point or lonely at some point, and everything has gotten so much harder during this virus. But even before the virus and thinking about going forward, emerging from it, there are structural issues that we need to address to ensure that we're meeting the social and emotional and mental health needs of older adults in rural areas, and really of all people in rural areas. One of the fundamental issues that I see, no matter what rural health issue I'm studying, is transportation. It's a perennial barrier, everything from infrastructure of roads to availability of transportation, personal transportation and public transportation, and particularly for people with functional limitations or mobility impairments, ensuring that there is affordable, accessible transportation, not only to get to the doctor, but to get to the hair salon or the community center, to socialize with others, perhaps to get to a place of worship. There's a lot that we can do to help people get to the places they need to go. During COVID, I also think it's worth mentioning again the digital divide. And not only do rural areas have reduced access to broadband internet, reduced access to cellular connectivity, but rural residents are less likely to have technological devices, even if they have broadband internet or cellular connectivity in their area. The Pew Research Center has done some really nice work on this, showing that rural residents, and especially rural older adults, are less likely to own devices where they can do this sort of thing. Be on Facebook, connect with people virtually. It's certainly not true of everyone. There are plenty of older adults who do have that, and including many in rural areas, but we see significant gaps and places where we can do more. And again, during COVID, these issues have become more pronounced. They've become especially pronounced in long-term care settings. Just in the past week or so, there's been some new research showing that some residents of long-term care settings have had a cause of death listed as social isolation, failure to thrive. We know that people were lonely before. Many people were lonely, too many people were lonely, and it's only gotten worse. I think this is an opportunity for us to think about how we can do better coming out of this.
Thanks so much, Carrie. Okay, Angie, this next question is for you. Lucas wants to know, with COVID, I was wondering what you are doing to make sure healthcare doesn't become too expensive for those infected with the virus.
Well, Lucas, thank you so much. You know, healthcare is too expensive overall. It's been one of the things that I focused on since I was sworn in as a member of Congress. And it's not just the cost of health insurance. Of course, I would add a public option to have it compete with the insurance companies, so that in the individual marketplace, particularly in these rural areas where we have very little choice, there would be more choice. But with COVID specifically, I worry about a few things. One, you know, we advocated for and put money in the HEROES Act to make sure that everyone had access to free testing, because you really, really want people tested so that you can isolate them and tamp down the community spread. That's why we're seeing such a high and growing positivity rate right now, because community spread is sort of running rampant here. I worry a lot about what happens if the ACA gets thrown out, and those folks with pre-existing conditions, well, those are all of the millions of people who've now had COVID. You know, how do they get access to health insurance, or can they get access to health insurance if you do not have those pre-existing condition protections in place any longer? I worry a lot about the 20 million Americans who are on health insurance today because of the Affordable Care Act, because of the subsidies, because the states who expanded Medicaid in their states. And, that's what the ACA Stabilization Act was about, HR 1425, which the base of the bill was my reinsurance bill, which would lower the cost of health insurance in the individual marketplace between 8 and 10%. That was the whole point of it, to provide additional incentives to make sure that people had access and were covered. At the end of the day, though, we're going to have to tackle the high cost of health care, not just the high cost of health insurance. And in the long run, that means we're going to have to be willing to take on big pharma. We're going to have to be willing to take on patent exclusivity for 12 years in the US. And we're going to have to look at the fee-for-service healthcare system that we have in place. So we got to get this pandemic under control. But even before the pandemic, we had a long way to go to improve access to and cost of healthcare in this country.
Thanks so much, Angie. Okay, this next one is for Carrie. Carrie, Sue wants to know, isn't it really difficult for Minnesota to keep COVID infections down when all of the states around us, North Dakota, South Dakota, Iowa, Wisconsin, do not have a mask mandate? Should there be a national mask mandate?
My short answer is yes and yes, but I will elaborate on that. This is why I mentioned those surrounding states when I gave my opening remarks. When you look at the map of the country, usually they use red to light up the states that are considered hotspots. And right now, Minnesota looks like a sitting duck in the sea of red. We're orange, which is not great. We want to be kind of blue or green, according to those map categorizations. But we're surrounded by a sea of red, of hotspots, of places where the virus is truly out of control. And in some of these states, in the Dakotas, Iowa, Wisconsin, we're seeing them need to build field hospitals to have the capacity to serve folks who come down with COVID-19 and need hospitalization. We are seeing crises in getting enough healthcare workforce in the door to provide the care that's needed and to keep them safe, let alone all of the issues with having enough supplies for testing and keeping everyone stocked with the PPE that they need. These are enormous issues. We don't want to get to the place that these other states are at. I want to see those other states come down. I want to see all of us come down. But one thing that I think is important to emphasize is that the virus doesn't care what state you live in, and the virus doesn't care about borders and boundaries. There have been some efforts to close some national and international borders. We can't do that as easily in states and in interstate travel. Some people access healthcare at the next state over. Some people have caregiving responsibilities, work, loved ones, the next state over. We are closely intertwined with these states, and what happens in these states we should really care about. For that reason, I strongly believe that all along it would have been helpful to have a stronger federal response, and I think we should still have a stronger, more coordinated federal response. I would like to see a national mask mandate. I know not everyone would agree with me on that point. But again, the virus doesn't care what state you live in, and the virus can travel pretty easily. And so I think we need to consider this as not one state against another, but all states together and doing everything we can to keep everyone safe.
Thanks so much, Carrie. Okay, Angie, this next question is for you. Jeffrey asks, can you comment on attempts to politicize the U.S. Postal Service?
Jeffrey, thank you so much for the question. I just have to say thank you right now to any of those letter carriers out there, all of the employees of the U.S. Postal Service. I know you are doing your level best under very, very difficult circumstances. Yes, there's the short answer. We should not politicize the U.S. Postal Service. They have been doing an extraordinary job, but many of the changes put in place by management, I'll just put it that way. The Postmaster General, Louis DeJoy, have led to service level issues inside the U.S. Postal Service. And, I don't know I'm not going to propose intent, but the outcome of moving all of those sorters of, putting the restrictions on overtime in place that our letter carriers talk to us about, the impact of that, the outcome has been that very desperately needed prescription drugs to this nation's veterans and vote by mail ballots have been slowed down and delayed, and it's really just inexcusable. So one of the things that we required as part of the HEROES Act was a commitment to restore the service levels that had existed before all of these management changes were put in place. And keep in mind that there are individuals in government who for a very long time now have been trying to make it look as if the U.S. Postal Service is failing in an effort to privatize the U.S. Postal Service. The USPS is literally in the U.S. Constitution. It is a service provided to Americans, and it's enabled, obviously, rural areas, as Carrie talked a lot about that over the years, to have more equity in receiving correspondence. And I want to end this by saying, look, just as there was a debate once over whether everyone in this country should have access to a mailbox, there's a debate today over who should have access to broadband and high-speed internet. That is a debate we shouldn't even be having. One of the letters that I wrote to the Treasury Secretary most recently asked them to allow the CARES Act funding to our local communities to be used for broadband, for high-speed internet in our communities. The guidance from Treasury was that that couldn't be used for that purpose. Well, that's ridiculous. The inequities that exist in education, in healthcare, in rural areas are only exacerbated when those communities don't have access to broadband. And so, I know your question was about USPS, but at the end of the day, we need to make sure that we stay connected in our world to one another, and both of those are ways to do that.
Thank you so much. Okay, this next question is for Carrie, and both Angie and Carrie have talked about numbers going up in Minnesota. The question is, with community spread so wide, is contact tracing still a helpful way to control the pandemic?
So Angie talked about this a little bit earlier, but we are a little bit past the point of contact tracing being useful to understand the spread at this point. Angie mentioned the test positivity rate is around 7%. This is the rate of COVID tests that come back as positive. We want to see it around 5% or lower to really be able to do contact tracing. Contact tracing is a wonderful and very effective tool, especially early on in a pandemic or some sort of epidemic, where you can understand exactly who someone had contact with. You can pinpoint specific instances. When the virus gets to a level that we call community spread, when it's working its way through the community, contact tracing becomes much more complicated, much more arduous, and less effective. What is really useful to put our resources into at this point, beyond all of the personal measures we can take, is to make sure that we have access to good testing supplies, work toward more rapid testing and availability of rapid testing so that people can quickly know whether or not they have the virus and they can self-isolate.
Thanks so much, Carrie. Angie, this next question is for you. Kathy asks, thank you for supporting the funding of Alzheimer's research thus far. With the current status, what are your plans to make sure that money is going towards research for finding the end of Alzheimer's, in addition to supporting caregivers?
Kathy, what a great question, and a really personal one to me. My own grandfather suffered from severe dementia and Alzheimer's late in his life, and it's a cruel disease that robs folks of their memory. It robs them of dignity, and is a very, very difficult disease for a family as well to watch. So, I am firmly committed to supporting research into Alzheimer's. I voted for an appropriations package. In fact, I think it was in July, that included 2.9, just under $3 billion in Alzheimer's disease and related dementia research. And that was a significant increase over the prior year funding. So you have my commitment that I will continue to be a strong supporter to someday eradicating this very cruel disease.
Thanks so much. Okay, back to Carrie. Carrie, you talked earlier about how we all just want to get back to some sort of normalcy. So this question is there a chance that the timeline for the development of a vaccine could be shortened?
I wish there were. I wish I could snap my fingers and have one here. The thing about a vaccine is that it has to go through certain phases to ensure two things: to ensure that it is safe, that there are not unacceptable risks of the vaccine, and to ensure that it's effective. If it's not both safe and effective, it's not going to work. And you can only determine those things by going through a series of phases. And especially the effectiveness takes a period of time to understand. Does the efficacy of the vaccine wear off after a few weeks? Does it stick around? And so we really need to ensure that it is both safe and effective. And there are certain protocols we have to go through to get there. That said, this vaccine development process has worked faster than we've seen in nearly any other vaccine development in our history, in the history of vaccines. And there are a lot of people and a lot of very smart researchers working on this issue, working as hard as they can to ensure that we get that vaccine that's safe and effective. The problem is if the process is rushed, and if we get a vaccine that proves to be either not safe or not effective, it could backfire, and we could see issues with people refusing to take the vaccine, which wouldn't help to move us forward.
Thanks so much, Carrie. Okay, this is our final question of the night, and it is for Angie. Angie, Leah wants to know, regardless of the outcome of the presidential election next week, will you work to reunite the families that were torn apart at our borders? And also, what ideas do you have for immigration reform?
Well, thank you, Colleen, for the final question. Leah, thank you for that really important question. Absolutely, I will push whatever administration is in office after January of next year, and this administration right now, to continue to try and reunite these families that were separated at this nation's borders. You know, as we think about immigration reform, I keep coming back not only to thinking about the humanity of how America was formed and who we are and how we come from, you know, so many different places if we're not native to America. And, you know, I think about one of my last conversations with Federal Reserve President Neil Kaskari here in Minnesota, that actually immigration reform would have the biggest impact on this country's GDP growth. When you think about the fact that 40% of Minnesota's Fortune 500 companies were founded by either immigrants or children of immigrants, you look at the economic opportunity. When I talk to my family farmers throughout this district and they talk about the need for year-round labor, look, I believe that we can get back to a time in America when people like John McCain and Amy Klobuchar were working together for true immigration reform. Remember, the Senate passed, I think it was 68 votes, a bill that would have kept our borders safe, provided more technology to be able to detect drugs at our border, and allowed for a path to citizenship for this country's dreamers. So I think we can be that kind of America again, and I look very forward to being a part of that.
Okay, thank you so much. I just want to say thank you to everyone for joining us tonight. Thank you for all the questions that were asked. It was really a pleasure for me to get to ask them on your behalf. Thank you, Carrie, and thank you, Angie. And right now I'm going to turn it over to Representative Craig for some closing remarks.
Thank you so much, Colleen. You did a marvelous job, as usual, in moderating the town hall this evening, even in a virtual format. Carrie, thank you so much for your words. I can feel and hear the stress and anxiety in your voice as you try to implore each of us to do the things that we need to do to keep one another safe, wear a mask, social distance. I know that public health officials like yourself and essential and frontline workers are doing everything possible to keep our community safe. And I personally just want to say thank you for that. I had an opportunity to take lunch yesterday to Dakota Family and Child, which serves an underserved, underinsured population here in Burnsville. And to walk in there and to hear about the positivity rates that are occurring here throughout Minnesota and throughout the nation. My biggest ask here as we close this 22nd town hall is let's trust our public health officials. Let's trust our scientists. Let's get to a vaccine in this country as quickly as possible. But at the same time, it's going to be some time before we get there. And let's just be as kind as we can to each other along the way. So thank you so much, everyone. It's truly an honor to represent the 2nd District of Minnesota. And I'm looking forward to getting back to Washington and hopefully press Republicans and Democrats to get a next COVID relief bill through. Thank you so much.